Thank you so much for joining us on this episode of Family Matters. My name is Purity Museo. While HIV and AIDS remains a global public health concern, those living with the virus lead a long and healthy life courtesy or thanks to the kind of response treatment option and the drugs that they use to suppress the virus. All right, today Kenya joins the rest of the world to mark World AIDS Day, and there was a concern raised. This is increased infections, new infections among the adolescents and also young mothers. Why do we have these cases increasing, and what can be done? What are some of the treatment or campaigns or responses that needs to be done as far as the key populations are concerned? Joining me on that discussion tonight, next to me is Justin Kithure. Justin is the Regional Prevention Coordinator at AIDS Healthcare Foundation. And then next to Justin is Kennedy Mutai, who is a Programs Officer at National AIDS Control Council. And then at the far end is the beautiful lady, Duece Malava. She is the Programs Officer at AFYA JIJINI. Thank you so much, guys and lady, for joining us for this discussion. Let me start with you, Kennedy, from the NACC. Yeah. I know you are the key organizers for the National World AIDS Day celebrations in Kisii County. Maybe you can tell us some of the steps, and before the steps, what are some of the new commitments that have been made amid revelations that now we have increased HIV infections, especially amongst the adolescents?
Thank you, Purity. I'll start by highlighting why the World AIDS Day.
Yeah.
And today, the country marked the World AIDS Day just like many other countries within the globe. And the World AIDS Day started back in 1988. And the reason as to why we are commemorating the World AIDS Day is to increase awareness of HIV pandemic among the communities, within the country. The importance of this day is to ensure that the globe unite to ensure that we stop new HIV infections, to ensure that we unite to support those who are HIV infected and those who are affected. And at the same time, and most importantly, is to remember the many lives that have been lost due to AIDS. And so as a country today, we commemorated the World AIDS Day across the 47 counties, with the national event being marked at Kisii County that was graced by Her Excellency, the First Lady of the Republic.
Yeah.
Yeah.
Right.
And so there were key highlights from this year's World AIDS Day. I later, of course, speak about what was our theme, but the key commitments are around what can we do as a country as far as adolescents and young adults is concerned? What can we do as a country as far as prevention of mother-to-child transmission is concerned? And most importantly, in line of today's theme is we need to bring the community at the center of the response and ensure that no one is left behind.
All right. And as we look at those, let me stay with you, Kennedy. As we look at those highlights, issues to do with involving the communities, mother-to-child transmission, tell us the statistics, where we are as a country, the numbers of the infections, increasing numbers, reducing numbers, who are the key population or at a risk of getting HIV?
Well, Purity, let me start with highlighting where we are globally. Globally, we have about 37.9 million people living with HIV. And among the 37.9 million, we have a big, about close to 60%, that is about 20 million in the Eastern and Southern Africa. And globally as well, we have about 1.7 million new infections annually, which is still quite problematic. And we have about 770,000 AIDS-related deaths. And, that is the global perspective. Coming close home, where we are as a country, we have about 1.5 million people living with HIV. In terms of thinking about it as prevalence, we stand about 4.7%, loosely translating to about 5 people in every 100 living with HIV. In terms of new infections, our statistics in the last year, we had about 45,000 new HIV infections. And here we have about 38,000 adults new infections and about 8,000 children new infections. We had about 25,000 AIDS-related deaths, with 20,000 being among adults who are aged 15 years and above, and about 5,000 being among children.
Right.
But the statistics go beyond that. We have, the 90-90-90, which is kind of our commitments to ensure that 90% of all the people who know their HIV status, who are HIV positive, know their HIV status, and we need 90% of those who know their status are put on long life treatment, that is antiretroviral treatment, and we have to ensure that among those who are on antiretroviral treatment, 90% should be virally suppressed. In other words, the virus in their bodies should be way below, they should not be detectable.
All right.
Yeah.
And we've reported as a country new HIV infections amongst the adolescents and young mothers. What could be the possible cause for that?
I believe the possible causes of the increase in the infections among adolescents and young women is probably the lack of involvement. We need to involve the adolescents more in their own treatment. If we are able to listen to their voice, what they would like us to do for them, how they believe that they should have their treatment tailor-made for them, I think that having that more inclusivity for them would be a better option, and it will help them to actually own their care. And in essence, having them own their care, it means then they would be able to be better in charge of whatever it is that they are taking. They take charge of their medical care, they take charge of their treatment, and they take charge of their health. So having that ownership, I believe, is what is key.
Yeah,
yes.
And you'll be telling us whether the adolescents should be subjected to the same treatment journey as the adults, because there's that dilemma on the treatment, especially on the medication for the adolescents. Do they lie in the adult side or the children's side? You will tell us that, but not before Justin. Maybe Justin, tell us more about HIV. It's not good to really assume. What is HIV? What is AIDS? The transmission? How is it transmitted?
Thank you, Purity, for that. And we are happy that, as my colleagues have highlighted, the strides that you are making as Kenya. And we can say that the battle is not yet over, because we still need to keep the same force that when we started, because we don't want to go back. It is good for this understanding, as you're saying, that HIV is a virus. And I know most of the times that people mistake HIV and AIDS, because AIDS is the end term, that is of the HIV. So we, as a country, what we are preventing is to go the end stages. That is when we get AIDS, when you get opportunistic infections, that is when you say you have AIDS. And HIV is just a virus. And one thing that you should know as a country where you're fighting is because HIV doesn't kill. Because when you take the medication, you doesn't progress to AIDS, whereby you are in the last stages. And then you doesn't progress, you don't have those opportunistic infections, other infections. And the modes of transmissions are many, and that is why we are, as a country, we are engaging in prevention of infections. Because one thing that we have the sexual contacts, having sexual contact with somebody who is infected without the protection. That is one mode of transmission. Also, we have mother-to-child transmission, whereby the transmission can occur while the mother is pregnant, during pregnancy, and during delivery and during breastfeeding. That's another mode of transmission. Also, through contact of body fluids. We know HIV virus can be found in body fluids. When you get contact with the body fluids, and without using the protection, then you are able to get infected. And that is why we are saying there is various aspects of the transmission of HIV, and that is why we say HIV cannot be fought from one direction, and that is why involving everybody, even adolescents, mothers, for the EMTCT, elimination of mother-to-child transmission, because for a free generation, then we need to fight it from all corners. And that is how we are going on progressively in the HIV.
Yeah, and Kennedy, let's, I know there are people, you both take care of people living with HIV and also people who are not living with HIV, but to protect them from getting HIV. Let's talk about the people living with HIV. What are some of the help or services that are available for people living with HIV?
Okay, so first to say, as the National AIDS Control Council, we engage quite often with networks of people living with HIV. And this is through what we call the MIPA, that is meaningful engagement of people living with HIV, to ensure that people living with HIV are in the center of the HIV response. If we are talking about policy development, if we are talking about programs and interventions that we are thinking about as a country, they should be at the center stage of the response. So what is available? We have, of course, scaled up antiretroviral therapy to ensure that people are able to access treatment. And Purity, this has come a long way from quite when in 2003, when that was about 5%, to now when we have about 1.2 million people who are able to access antiretroviral therapy. This has two advantages. The first one, of course, it will ensure that people living with HIV live a healthy and productive life like anyone else. And on the second part, it ensures that people living with HIV have a viral load that is not detectable, and they are not able to transmit, or less likely to transmit HIV to their partners. Other than that, of course, there are psychosocial support to ensure that it's a journey. It's not just going and pick your daily pills and you should be able. In between here, there are a lot of things to do with side effects. There's still stigma in the country, and we are trying as much as possible to ensure that we are speaking about, we are providing the anti-stigma messages across the country to ensure that people living with HIV are able to come out to take their medication and to be provided with psychosocial support along their journey. Yeah.
There are people who say that the pills or these drugs are not, let me say, so friendly. Is it because of the side effects? How exactly are they? Are you supposed, as someone living with HIV, how are you supposed to take this dose?
So, of course, there is science involved in it. And there are daily pills that are being provided, and you are supposed to religiously take your pills. And like any other drug, of course, we're going to have some side effects. But over time, innovations comes, and currently, recently, the Director General at the Ministry of Health was able to provide guidance about the available regimens, which quite have undergone some over the time, to ensure that the side effects are fewer and fewer, and to be able to ensure that we encourage people to take medication even despite of the challenges that they'll encounter, and get that support that they need throughout their lifespan.
All right. Just tell us the services available for people who are not with the virus, the HIV negative people, because at the same time we have discordant couples. So what is the assurance? Because there's a lot of stigma, especially if you tell your partner. We've seen a lot of marriages break because one person has been found they are HIV positive. So what is available for people negative, and they, of course, to just assure them that they can, yes, stay and live with the people who are positive?
Thank you, Purity, for that question. Now, people who are negative, who have a negative HIV status, they have many preventive services for them not to acquire the virus. So for them, if, for example, they are in a discordant relationship, then for the positive partner, we would encourage them to be on medication, that is on antiretroviral therapy. However, for the negative partner, there are many ways that they can be able to prevent themselves. One of them, the first one being a pre-exposure prophylaxis, whereby if the HIV positive individual has a high viral load, or they would like to probably be intimate, and probably they would like to get a child, the HIV negative partner can be put on preventive prophylaxis, so that they can be able to reduce the chances of them getting the virus. Another way that the HIV negative individual can prevent themselves from getting the virus is through use of condoms. Condom use has been advocated very many times in the fight against HIV, in that as long as someone is being intimate with someone who's HIV positive, then they would be required to at least use a condom appropriately in such a way that it works in a way so that they don't put it in a way that can interfere with the process, how it looks like.
Yeah.
So then that means that once the HIV positive individual and the HIV positive excuse me. Another preventive measure that the HIV negative individual can be able to prevent themselves from getting the HIV virus is by ensuring that they help their positive partner to be more adherent to their medication, because once they are adherent to the medication, then it means that the viral load is suppressed. And once the viral load is suppressed, now there's an aspect called U is equal to U, whereby undetectable is equal to untransmissible, whereby studies have shown that people who have a suppressed viral load are basically not so they're less likely to transmit the virus to their negative individual. So another way that the HIV positive partner, and especially if it is a male partner, there's a procedure called voluntary medical male circumcision, whereby studies have shown that this has been able to reduce the transmission of the virus by up to 60%. However, this is not only in isolation. They use the VMMC, voluntary medical circumcision. You also use the condom. You also use the PrEP medication.
Yeah, all right. Thank you so much for that insightful comments. Justin, tell us, where is the gap? Because every year when we mark World AIDS Day, we get new information. There is another group that is now, on target for new HIV infections. Where is the gap as far as the global fight against HIV is concerned?
Thank you for that, Purity. And I believe, as we started by saying, the theme for this year is towards UHC and communities all united towards a free HIV generation. And I'm happy this year we involved the churches, because for a long time I think we need to come out together as a group and as a community, because the community involvement is very important. Because I think the reason why we have been having a gap, we need to ask ourselves, has there been a gap between involvement of communities and us professionals? And that is why I'm happy for this, like even like Nairobi County, where you are in Calvary Temple, Buruburu, the church took lead in terms of organizing for this activity, and this has been cutting across all the counties, even other counties that we are in, whereby the church has taken lead in organizing for fight against HIV, because we want to talk about stigma reduction. So I think the gap has been in terms of not all of us has been there to fight against HIV. And I think that is why this time, because it came on a Sunday, we were just talking of communities, and church is one arm of the community. And we are happy that for this fight to continue, the communities have to own up. We are talking of stigma, whereby like the question you're asking about discordant couple, whereby one person gets infected and the other one is negative, and maybe one chases the other one. This is all because of stigma. But if people have no range and they're fighting together, they will just sit down and be able to talk. We can live with this because there's medication and the like. So one thing is about in the involvement. The other thing somebody talks is about the adolescent, is how are we be involving our adolescent? Parental responsibility also is lacking, because in the new days, in the current days, how much have we taken parental responsibility? Whereby we have left the children alone. And as we turn 1 month of transmission, so it has increased. We are talking of adolescents right now. So as parents, how much we engage in talking about sexuality issues with our children? How many times do we sit down and talk with them about HIV and AIDS? Or we see that as a responsibility of the teachers or other people in the society? So parental responsibility is also key. And also the other thing we are saying is also all of us to look at each other, not at the stigma high. When somebody is infected, is a member of a society, let's look at it as a disease like any other, because HIV doesn't kill, because we have other diseases, chronic diseases. So we need to look at HIV at another angle of the high, and then we are able to fight with it.
All right, thank you so much for addressing the stigma aspect, because time is not on our side. Kindly, Kennedy and Duece, be very brief, 30 seconds, because Ken, I really would want you to help us understand who are among the key population groups who are at a risk of getting HIV.
So among the key populations, we first have female sex workers. And, these are group population who are engaging on sex as a means of livelihood. And so they are still at high risk of HIV acquisition and contribute actually the highest among new infections when you think about key population broadly. And the other key population group is male who have sex with male, the MSMs. We have the people injecting drug users, and because we need as a country to ensure that first we have an enabling environment in which the key population are able to get and access services.
Okay.
Yeah.
All right, thank you for that and for keeping time. Is it possible to eliminate HIV, and what needs to be done to achieve that? If yes, is the answer.
I want to say yes.
No.
Okay.
Okay, yes, because I believe that if we are able to reduce the spread of HIV such that to a low level, such that the transmission is, and especially looking at the maternal to child transmission, kicking that before someone gets the virus, before, like, reducing the transmission rate, involving everybody in the fight against HIV, it is possible. However, until we address the issue about stigma and the issue about people owning their care, because whenever you go to any given facility, you realize that people would either take the medication because the doctor has says take the medication. They do not own it. They don't have that ownership.
Yeah.
So if people would have that ownership and they would reduce stigma and they would embrace the different methods to be able to prevent the spread, and if we also involve the meaningful involvement of people living with HIV, I believe at some point, yes, we can be able to eradicate the
All
virus.
right, and thank you so much for your time. Thank you, Kennedy. Justin. Thank you, Justin Kithure. Thank you, Kennedy Mutai. Thank you, Duece Malava, for coming and having this discussion on the World AIDS Day. I do appreciate.
Thank you.
And of course, for cutting your journey to Kisii short just for us. Thank you for your time.
Too.
Right, thank you also to our viewers for watching Channel 1 News Weekend and Family Matters Tonight. My name is Purity Museo. It's been great having you with us. Of course, we are not winding up because up next, I will be bringing you the day's sports news. Do stay with us.